Welcome back to another episode of Granite List Live. I'm Sally Pace, and I'm a proud SIIA committee member, and also thrilled to be partnering with SIIA here at Engage 2022 to bring you this episode. We're joined by Keith Hodges. Keith, do you mind telling our audience a little bit about you and your company?
Sure. So I'm Keith Hodges. I work at Health Plans Inc., HGI, on the sales side. We are a third-party administrator in this space. New England roots, but a national company now. We have about 500 clients and around 350,000 members covered. We do everything from traditional networks, United, Cigna, Harvard, to RBP, to narrow networks, to domestic steering of hospitals, anything and everything, you name it. And it's kind of our forte is really claim management and member services.
Thank you very much. And you guys are diamond members with SIIA. So do you mind telling a little bit about what that membership is to you guys?
Yeah, I think it's important to stay invested in SIIA at all levels, especially show the commitment, because really SIIA is the representation of the industry. I think that sometimes what gets lost is the work that SIIA does behind the scenes that we don't necessarily see that their employees are doing, whether it's advocating in the legislature, putting on their regional events, side packs, you name it. It's really important to show the commitment as an industry, commitment to the industry as a company, that we're a part of this space and we're invested in it, just like we're investing in our own individual careers, our own company success. We're investing in the industry because we need to look out for each other.
So, Keith, I want to get personal for a second because you are on the up-and-coming side. You're in the future leaders group. What drew you to this industry?
Yeah, so I kind of bounced around a little bit. I worked in a school system teaching for a year. I worked in law enforcement for about a year and a half before ending up at HGI. Really, personally, I think the private sector was for me. I think I kind of needed that drive, that challenge to always go. Not necessarily being a union, public employee, nothing against it, but it just didn't fit me. And this aspect of the industry, the self-funded industry, really was driven to the ability to impact members' lives, make a difference, kind of, get off that fully insured Ferris wheel, so to speak, of just renewals every year, and really get some creative solutions. And that's kind of what's keeping me into it, is every day you can learn about a new vendor and your plan, and really make unique impacts. And there's always something new. It sounds so cliche, but every day is different.
Awesome. Well, tell us a little bit about when you think about the industry and the things you see happen, just since you've been here, and you think about the future, what does that look like to you and in your age category?
Yeah. So I think now more than ever, it's important to kind of keep the relationship industry. Everybody always says going back, it was a relationship industry. And if you look at, there's kind of the old guard, so to speak, where everybody knows each other and has been around for 20, 30 years working together. I think what's important now with how many cargo vendors there are, how many networks there are, how many TPAs there are, brokerages, that people realize that you need to keep those relationships now. You can't just be spreadsheeting. You can't just be plugging and placing things, because you need to know how all those pieces fit together. And I think sometimes that gets lost with all the superfluous options that we have out there, that if you're not actually getting to know the people behind the scenes, not talking out how the TPA is going to work with the vendor, is going to work with the client, is going to work with the broker, is going to work with stop loss, so they're understanding all those pieces, you'll just end up with a poor member experience. So you really need to reemphasize that relationship piece on all sides, and we're not just each selling our own pieces of the industry to the client directly.
And I love the depth of knowledge that you just bring to into the space. Somebody who I think is on the old guard side, it's really fun to see this resurgence. And I love you talking about relationships. I think there's this push and pull, app-driven versus human touch. So what fuels your passion? Any success stories you want to share that you're really proud of being a part of?
We do a lot of unique things at HPI. We've recently invested in a company, Employees Health Network, EHN we call it, and they build regional networks in different states. Texas is one where we've been able to build this quality alliance with Baylor Scott and White, so we can really drive quality care uniquely to those members. Us, our medical managers, MedWatch, and the hospital are all sharing files back and forth, sharing notes back and forth. So the members have really high touch quality care. It's kind of those fun things, without going, boring everybody going into individual cases. It's just those kind of fun pieces, seeing them come together. That is kind of like, all right, you have 1,000 pieces of the puzzle. What's the ultimate picture you're trying to create? Is that member experience, that ease of access to a fractured healthcare system? How do we make it fit together? So that's kind of what keeps me going, and every case is different, really, in terms of where the employees are and what group is looking for.
Well, that is not boring. We've all chosen to be in this industry, so don't worry. It is exciting to all of us, and I love your passion. I really appreciate you sharing your story, for being here, for helping to make Engage 2022 a great event. Thank you for your leadership within SIIA. And thanks to everybody for listening to another episode of the Granite List Live.